Guys, what's up? Welcome to my YouTube channel. In this video, we are talking about palatine tonsil. The topics covered in this session are given here. First, we will talk about introduction. Then we will talk about the location, parts, and relation of palatine tonsil. Then, with respect to the relation, we will take into account tonsillar bed. Then we will talk about arterial supply, venous drainage, and we will end this topic by discussing the nerve supply of palatine tonsil. So without further ado, let us start. Now, what is palatine tonsil? You see that in relation to oropharyngeal isthmus, we are having several aggregations of lymphoid tissue, and those aggregations of lymphoid tissue, they are arranged in such a manner so that they are forming one ring, and this ring is called Waldeyer's ring. Now you have a look at this diagram. You see that the Waldeyer's ring, they are basically formed by four aggregations of lymphoid tissue. What are they? Nasopharyngeal tonsil, tubal tonsil, palatine tonsil, and this is the lingual tonsil related to tongue. Yes, now in this session we are talking only about the palatine tonsil, and remember that this is the most important aggregation to be taken into account, and hence when we talk about tonsil we refer to palatine tonsil mainly. Now, what are the parts of palatine tonsil? But before going to the parts, we have to know how a palatine tonsil looks like. Always remember that palatine tonsil, it is almond shaped, and the size is also similar to an almond. Okay, now it has two surfaces, two borders, and two poles. Let us have a schematic diagram. So this is the basic structure of palatine tonsil. The blue colored surfaces that I am highlighting, this is the medial surface. On the other hand, this red colored surface, it is self-explanatory, it will be lateral surface. Yes, now it will have an upper pole and one lower pole, and thus the border which separates the medial surface from the lateral surface anteriorly. Here you can see this one. This is known as anterior border. On the other hand, there will be one posterior border also which separates lateral surface from the medial surface posteriorly. Okay, after discussing the parts, now we come to the relations of the various parts of palatine tonsil. Now you always remember one thing, that the poles, the upper pole of palatine tonsil, this is related to soft palate. On the other hand, the lower pole, this is related to tongue. Okay, the lateral surface of palatine tonsil, this is related to the capsule. Yes, now what is the capsule? That this capsule is not complete, it is hemicapsule. It only covers the lateral surface of palatine tonsil, not the medial surface. And this capsule, remember, this is a continuation of pharyngobacillar fascia. Now, what is pharyngobacillar fascia? This is also important, that pharyngobacillar fascia, it is the middle part of carotid sheath. Okay, now what are the structures that are related to the medial surface of this the palatine tonsil? Now always remember that this medial surface, it is directed towards this oral cavity or the oral mucosa, and this medial surface, you can see this. For example, if this is the palatine tonsil I am drawing, this is the lateral surface. The medial surface, it is not uniform. You are having several clefts. Okay, these clefts or depressions, they are seen on the medial surface, and very prominently the most superior cleft, this is known as intratonsillar cleft. Yes, this is known as intratonsillar cleft, and this is the most prominent cleft of the medial surface of palatine tonsil, and most people, they generally confuse it with supratonsillar fossa, but no, this is included in one of the clefts of palatine tonsil. These are generally, they are the characteristic of the lateral and the medial surface, or the fissures of lateral and the medial surface. What are they? Laterally we are having the continuation of pharyngobasilar fascia, which is actually the hemicapsule. On the medial side we are having clefts. Okay, now we come to the location of the palatine tonsil, where it is located basically. Now you can see that this is the palatoglossal arch, and behind this you are having palatopharyngeal arch. Yes, so between this palatoglossal arch and palatopharyngeal arch you are having palatine tonsil. Okay, now here the tonsillar bed. Now in relation, now I have already said this tonsillar bed is basically the relations of the palatine tonsil. And which relation? The relation to the lateral surface of palatine tonsil. Now again I have skipped one thing, that the anterior border. I have said that the upper pole is related to the soft palate, the lower pole related to tongue. The anterior border, it is related to, yes, the anterior border is related to palatoglossal arch. On the other hand, the posterior border is related to palatopharyngeal arch. Now this bed is formed from within outwards by pharyngobasilar fascia, superior constrictor, buccopharyngeal fascia, styloglossus, and cranial nerve 9, that is the glossopharyngeal nerve. Now how can we visualize this? You see that if you take into account the lateral relations, the structures related to the lateral surface of the palatine tonsil, and if you go from within outwards, then you can see that in this diagram here, the most here the most inner part, it is the pharyngobasilar fascia. This is the pharyngobasilar fascia, and then lateral to it we are having this superior constrictor, then lateral to it we are having buccopharyngeal fascia, then the lateral to it you are having this styloglossus, which mainly covers the lower part on the lateral surface of palatine tonsil, and then lateral to it we are having this glossopharyngeal nerve. So what are the structure related to the lateral surface from inner to outer side? This mainly constitute the tonsillar bed. Again, have a quick revision: pharyngobasilar fascia, superior constrictor, buccopharyngeal fascia, styloglossus, and glossopharyngeal nerve. Now we come to the final part of today's session, which is the arterial supply, venous drainage, and nerve supply of palatine tonsil. Okay, now come to the arterial supply. You see that arterial supply, it is from the facial artery by the tonsillar branches. These are the tonsillar branches, and this is the facial artery. From the facial artery, these tonsillar branches arises, and this will mainly supply the palatine tonsil. This is the main blood supply or main arterial supply, but there are some other arterial supply, for example the greater palatine branch of maxillary artery and so on. Okay, but the one thing to be remembered, that this is mainly the tonsillar branches of facial artery. Now what will be the venous drainage? Then remember that the vein, yes, this is mainly to the facial vein. The oxygenated blood, it will be carried from the palatine tonsil to the facial vein, and along with it I have forgot to write one thing, which is the lymphatic drainage. The lymphatic drainage of palatine tonsil is also very important. So the lymphatic drainage is through jugulodigastric lymph node. Jugulodigastric lymph node. What will be the nerve supply of palatine tonsil? That it is supplied by cranial nerve 9. you know that cranial nerve 9, which is the glossopharyngeal nerve, this is mainly the sensory nerve, and it will carry sensory information from the palatine tonsil, and it has some clinical significance too, because we know the glossopharyngeal nerve, it also carries sensory information from the air. Therefore, during tonsillitis, that is in the inflammation of tonsil, the pain is referred to the air. Okay, this is the first clinical significance. Now we come to the second clinical significance, that is the tonsillectomy. Okay, what do you mean by tonsillectomy? Tonsillectomy, it is the removal of palatine tonsil. You see in this diagram that the vein that I am demarcating here, this is mainly the paratonsillar vein. Okay, so during tonsillectomy, this paratonsillar vein can be injured, and therefore care has to be taken. Yes? Okay, these are the two clinical significance of palatine tonsil. And again I say tonsillitis, it is basically the inflammation of palatine tonsil. Another significance is that the palatine tonsil, it is one of the organs in our body which regresses with age. Generally the organs, they are actually increase or they progresses with age, but there are two organs basically, thymus and palatine tonsil. These are the two organs which regresses with age. Therefore in children we are having the large palatine tonsil. On the other hand, in adults it is relatively smaller. In this way we have completed our today's discussion of palatine tonsil. We have talked about the introduction, then location, parts and relation, and in this relation we are taking into account tonsillar bed, the arterial supply and venous drainage, and finally the nerve supply, and in relation to it we have talked about the pain in tonsillitis. Okay, so if you like my work, then please do like, share and subscribe to my channel. Thank you very much.